Good afternoon, and thank you for joining me today as we talk about the COVID-19 pandemic here in Erie County. Unfortunately, Mark is not able to be with us here today to interpret, nor next Wednesday, but he'll be back 2 weeks from today. We'll all miss him while he's gone. Today, we have 134 new cases to report as of late last evening, which brings us now to a total of 3,764 cumulative cases since March. 1,206 cases are currently active. Yes, over 1,200 cases currently active. 2,493 have recovered, and unfortunately 65 deaths have been reported in the NEDS database. This means that sadly we've had 6 new deaths over the last 6 days. We have 38,861 negative tests. Of the cumulative cases in Erie County, 54% are female and 46% are male.
We're having some technical issues. We're not on Facebook for some reason.
Okay.
So,
You want me to keep?
hold on, we can start over if you want.
Okay.
Because right now, the only people that can hear you are the media.
Okay. Okay. All right. We're having some technical difficulties, and we're going to start again, I guess. They're going to let me know because they are not on Facebook right now.
We'll start fresh again. You're live on all the networks, just not on Facebook, but other Facebooks.
Okay.
So I guess we can just push everyone to the networks.
Do you want me to start again?
There. Yeah, if you don't mind.
Okay. Okay. I'll start at the beginning.
Thank you.
All right.
You were good.
Okay. Thank you. Sorry for the technical difficulties, but I thank you for joining me today as we talk about the COVID-19 pandemic here in Erie County. I apologize that Mark is not with us to interpret today, nor will he be with us next Wednesday, but he will be back 2 weeks from today. Today we have 134 new cases to report as of late last evening, which brings us to a total of 3,764 cumulative positive cases since March. 1,206 of those cases are currently active. 2,493 have recovered, and unfortunately 65 deaths have been reported in the NEDS database. And this means, sadly, that we have 6 new deaths to report in the last 6 days. We have 38,861 negatives. Of the cumulative cases in Erie County, 54% are female and 46% are male. Regarding race and ethnicity of our total cumulative cases, 58% are white residents, 13% are African American and Black residents, 7% are Asian, 2% are other, and 20% are unknown. Regarding Hispanic origin, 4% are Hispanic of any race, 65% are not Hispanic, and 31% are unknown. The breakdown of cumulative cases by age shows that 2% have been ages 0 to 4, 2% ages 5 to 9, 9% ages 10 to 18, 16% ages 19 to 24, 37% ages 25 to 49, 19% ages 50 to 64, and 16% ages 65 or older. We have currently 64 individuals who are hospitalized in Erie County hospitals, with 6 of those patients being on ventilators. Our contact tracers at the Department of Health are overwhelmed, as you can imagine. We definitely do not want to overload and overwhelm our hospital systems. So in order to not do that, we need your help. As this surge in cases continues here in Erie County and truly across this nation, I am pleading with you to do a few simple things. Keep 6 feet away from anyone who does not live in your home, and wear your mask, and wash your hands frequently, and stay home if you are sick, and download the COVID Alert PA app, and stop gathering with people that you don't live with, particularly in large groups. Do what we know truly works. With the Thanksgiving holiday just 1 week and 1 day away, I want to reiterate a few things. I remind you that any social activity at this point is truly a high-risk behavior. Private gatherings have become a major force in the spread of COVID-19. That's because the coronavirus loves small, enclosed spaces, such as your home. While masks and distancing absolutely help to lower the risk of casual encounters, the longer that you spend indoors with an infected person, the higher the chance that enough virus will build up in the air to infect you. In a COVID-friendly environment, such as Thanksgiving dinner, it takes only one person with a false negative, or say someone in the family who believes that this is still a hoax, hasn't been tested even if they might have symptoms. This can spark a super spreader event. So I implore you to find different ways to celebrate this year. Celebrate wisely, potentially virtually, with your grandparents, your cousins, your brothers and sisters, your aunts and uncles. I know in my own family, we've changed our plans a number of times over the past weeks as we've watched this progress. So we're going to go for a family hike outside, wearing our masks. Then we will all depart to our own homes to have small, intimate dinners with those that we actually live with. And we're going to do big Zoom calls with extended family from across the nation. And in my family, even some of them serving overseas, we hope that they get on that Zoom call. I've heard of others where one family is making one of the dishes for Thanksgiving, enough for everyone. They're going to put it in small containers. They're going to all exchange that one food item that they're making, and then everyone will have a complete Thanksgiving dinner, and then they'll go back to their own homes. So every family is trying to figure this out, do things a little bit differently. Maybe you decide not to have turkey this year because it's an odd Thanksgiving. Everything's different. Why not go buy yourself a nice steak or maybe seafood or something else that you really love? So try to make this a fun and still celebratory holiday, giving thanks, first of all, for your health and the health of those that you love, and then give thanks for the fact that we hopefully will see a vaccine soon on the horizon. I ask you to please make this short-term sacrifice to avoid what truly could be long-term devastation. We must continue to use the few tools that we have right now to fight this virus. This week, Governor Wolf and the Pennsylvania Department of Health expanded on their targeted mitigation efforts. Now you must wear your mask when outside and you're with other people. Of course, when you're driving your car with other people, at all sporting events, whether you are inside or outside, you need to be wearing your mask. Wear your mask when exercising. Again, I've seen many of the gyms and other places are sending their members messages that all activity you must be wearing a mask. And please, please remember that your mask needs to cover not only your mouth, but your nose. If you are wearing a mask that does not cover your nose, it's like not wearing a mask at all. Again, we need your help. This surge is very frightening, and we need your help to control this virus. So while you're doing your part to fight COVID-19, why not share with us how you're doing it? Last week, we launched a Masks of Erie County Design a Mask Challenge. So we ask you to put the mask on that best expresses your uniqueness. You can pay homage to your cultural background, to your favorite sports team, showcase handmade designs, artwork, even celebrating the holidays coming up. All you need to do is post that image of you in your mask via Facebook or Instagram by December 1st. Use the hashtag Masks of Erie County, Masks of Erie County, and tag Erie County Department of Health on Facebook, and on Instagram, tag at County of Erie, PA, in every image of you in your mask. There'll be 20 winners, and we have gift cards for that, some from $50 to $200, just for showing us your great mask. Winners will be announced after 5 p.m. on December 8th. And you can find all the details on this, as well as take our Safe Choices Pledge at eriecountypa.gov. I encourage you to take that pledge and join us in the effort to slow down the spread of COVID-19. Regarding testing, we have all of those testing sites listed on our county webpage at eriecountypa.gov, but there are some changes next week because of Thanksgiving. The Martin Luther King Center and the Quality of Life Learning Center in the city of Erie will not be testing on their respective days next week, but Booker T. Washington Center in the city of Erie will conduct testing on Tuesday. Again, these details can be found at eriecountypa.gov. And now I'd like to invite Melissa Line, the Director of Erie County's Department of Health, to give us her update from the Health Department. Director Line.
Thank you, County Executive. It's always a pleasure to be on with you on your weekly press briefings. Unfortunately, the news that we're having to share today is not as positive as we have at past briefings. It was November 11th, the first day that we saw nearly 100 cases. It was 99 cases reported on the 11th. Since that time, we have been over 100 each day for 7 days in a row. Many of those numbers have been much over 100. We've had days of 124, 149, 135. Our highest of 167 was just yesterday, and today 134. You can imagine that those numbers have overwhelmed the traditional public health strategies that we've used with disease investigation and contact tracing. The disease investigators are no longer able to contact every single person, and contact tracing is only happening at a minimal amount when we are able to identify contacts of those known positives. I had mentioned that we were prioritizing those that were 65 and older, long-term care facility residents and employees, as well as those that are 18 and under. As of now, we're only able to reach the 65 and older and work with the long-term care facilities on identifying their positive residents and employees. This has also left us with a backlog of those that are 65 and older. I heard as recently as yesterday that we had 80 that still had not been contacted, and some of those had been as far back as the weekend. We are urging you to take action now so that we can stop the spread of COVID-19. There is on the website an update that I had put together, and I would like to reiterate that to you now. The Erie County Department of Health is currently unable to contact the majority of persons diagnosed with COVID-19. If you are told that you have COVID-19 disease, immediately isolate yourself. Do not wait until the health department contacts you to take this action. It is important that you stay isolated for 10 days from when your symptoms started, or 10 days from the test date. If you do not have symptoms, you are out of isolation on day 11. Isolation means no contact with anyone in your household, or very minimal contact if it is not possible to use your own restroom, and cleaning the restroom when you are finished. Also think about people that you are in close contact with during the 2 days before your symptoms started, or 2 days before the date that the test sample was collected if you did not have symptoms before that test. This is your infectious period, the time that the virus can be spread to others. Close contacts means 6 feet or less for 15 consecutive minutes or longer. Contact these people and tell them that you have COVID-19 disease. These people are at risk of getting COVID-19 disease based on their exposure to you. The incubation period for this virus is 2 to 14 days. Incubation is the time from when someone is exposed to when they could get the disease. Because it can take up to 14 days to show infection, these people need to quarantine. And the quarantine length for people who are close contacts is 14 days from the date of the exposure. You can release from quarantine on day 15. Each and every one of us must take responsibility for controlling the spread of disease with our friends and our families. We've said it so many times, but I cannot urge you more now than ever to wear a mask and keep 6 feet distance from anyone who does not live inside your home, and wash your hands and stay home if you are sick. We need your help, and we need your help now. So please take time, take care of yourselves, and be safe. I hand it back over to the county executive.
Thank you, Director Lyon. And now we're going to have Dr. Howard Nadworny, our infectious disease physician and consultant for the Erie County Department of Health, to share a few things and update us from his perspective. Dr. Nadworny.
Good afternoon. I am here to tell you that this outbreak and surge is threatening to overwhelm the hospitals in town. We are seeing our numbers go up very rapidly. I was working this weekend, and at the beginning of the weekend, we had about 20 people in the hospital, and we now have 35 people in the hospital with COVID. People who get admitted get better very slowly when they get better, and they often stay in the hospital for several weeks. This puts a lot of pressure on the staff who are trying to give them nearly intensive care because of their breathing issues, and who are also trying very strongly to avoid getting infected because these patients are very infectious. When the number of cases is increasing, it puts a lot of pressure on the staff and the whole hospital. And when there's a lot of cases in the community as well, it risks staff getting infected outside the hospital, requiring them to quarantine and reducing the number of staff we have available. There are only a few treatments we actually have for COVID, and one of them, convalescent plasma, is reaching very low levels in Western Pennsylvania and in Erie. And that's because of the number of people being admitted over such a short period of time. So we run the risk that we will not be able to treat people as well if these numbers keep going up. And the numbers appear to keep going up because people are having contact with each other without wearing masks. As the county executive and the director have said, wearing masks dramatically decreases your risk of getting infection, but being in close contact with other people and not wearing masks is very high risk for getting it. When I've talked to people about trying to decrease the risk of COVID and the risk of spread in the community, a number of people have said, well, why don't we let people take their own personal responsibility to slow the spread down? And I'm here to tell you that if we rely on personal responsibility, currently it appears that it's failing. And I think we're running out of time for people in the community to prove that on their own, they can take responsibility to wear masks all the time when they are out of the house, to wear masks when they are around other people, and to avoid group gatherings that people are not wearing masks at. If people can really do this rigorously, we can slow this epidemic around. We can reduce the burden on the hospitals, and we can reduce the number of people who are severely ill and die. But if we don't, then it's going to get much worse. And my fear is that we will be forced to do other activities to try to slow it down. And I would really like the community to avoid that. Thank you.
Thank you so much, Dr. Nadworny, for joining us today. And now we're going to turn to the media for questions for myself, Dr. Nadworny, or Director Lyon. We'll start with Erie News Now.
Afternoon. A question for Dr. Nadworny. Doctor, at the current rate, the way we're seeing cases spike right now and hospitalization spike right now, what's your best estimate? How much longer could hospitals in our area maintain the level of care they're able to give patients? How long before they'd be overwhelmed?
I do not know that, but at the rate that we're going, if it doesn't start slowing down within the next several weeks, I suspect the hospitals will be quite overloaded with patients because the staffing and the burden of care, even with just 60 something patients in the hospital, is quite high. It's still not a large percentage of the patients in the hospital, but the burden on staff is quite great. I'm not sure that I can tell you what that answer is, but based on what's been happening in other communities in the Midwest and the West, they became overloaded very quickly over a period of 4 to 6 weeks once the surge started there.
So it would be accurate to say here then 4 to 6 weeks, maybe a month?
I can't really say because I don't know the dynamics in the hospitals, but I would worry at the rate that it's increasing, it won't take a lot more weeks before the hospitals are starting to feel very pressured. And my concern is that that will affect elective surgeries, it will affect emergencies, it will affect hospitalizations for other things.
And doctor, just one quick follow-up. Realistically, is there any reason to believe that until we have a vaccine, this is going to get any better?
Oh, of course. If people sheltered at home, unless they had to run errands that were critical, if they did not socialize in groups wearing no masks, this would spread dramatically less, just like it did over the summer and spring. Absolutely. We totally have it in our power to control this.
Thank you. And now we'll turn to Talk Erie. Joel?
Thank you, County Executive. Another question for Dr. Nadworny. Dr. Nadworny, over the last 14 days, we've had 1,379 cases reported. Our average hospitalization is 33. Average daily hospitalization is 33, according to the Pennsylvania Department of Health. Can you help us make conclusions on how intense the virus is right now? Is this a stronger virus than in the spring or a weaker virus?
I think it's really no different than it was in the spring. I think the difference is that so many more people are infected, that the people who are more elderly, the people who have lung disease and underlying diseases, are getting sick enough and requiring oxygen and having to come into the hospital. So I think the numbers in the hospital just reflect the fact that the community has huge numbers of infected people. Most people are not very sick, but when they spread it to other people, especially older people, those people can get sicker and end up in the hospital. So what we're seeing isn't that the virus is more severe or less. What we're seeing is that so many more people in Erie are infected.
Do you have any kind of confidence that we are testing enough? I mean, with the high incidence rate and the high positivity rate, would this indicate that we're not nearly testing as many as you would like to see?
I've been saying for 7 months that we're not testing as many people as we should. We're limited in what testing is available. For example, the commercial labs are at risk of running out of their cartridges with testing more. We are clearly testing more, but we're primarily still testing people who have symptoms, and the proportion of people with symptoms has gone way up. So we're seeing a lot higher percentage who are positive because we just don't have enough tests in the community to be able to test as many as we should.
Thank you, sir.
Jet TV.
Hi, County Executive. It's Samir. So I want to get to the point, I guess. So taking a look at these numbers, I guess, what other further mitigation efforts are you considering right now instead of just, I guess, saying, hey, let's shut down for a couple of weeks? Is that in the works right now? What are you guys looking at? What's the team looking at from your perspective as well as Director Lyon?
Sure. So we are having conversations around what we could do legally and what actually might have a positive effect, because I think there's things we could do that we don't believe really would make much of a difference, because we're trying to figure out where the spread happens. And most of it is happening in private settings. It's happening in people's homes and when people gather personally together, and that's a very hard thing to control. But there are good conversations going on, and we are really trying to dig down and dissect what's going on in our community. And Director Lyon has had some conversations with others on the state level, and I'll let her speak to that.
Thank you, County Executive. As the County Executive has indicated, we're having discussions here locally, but in reality, I don't think we're ready to take any steps or action. We are providing feedback to the state around where we're seeing spread. When we were able to do comprehensive disease investigation, that feedback would be around gatherings, limiting sizes of gatherings, activities that are related to sporting events. I think I've said this before. The sporting activity itself, maybe it's playing a game. There may not be spread that's actually happening on the court, but it's all of the activities around sporting events, such as carpooling or going to multiple events, cheering on the sidelines, having dinner or celebration meals afterwards. It's all of those things. The continued wanting to socialize and find our normalcy is leading to increased spread in the community. So we're providing them feedback, but I am not able to say what I think will or will not come from that at this time.
Then just a quick follow-up for you. What do you think the best measures to take would be? Do you think a shutdown is appropriate at this point? Or, I mean, obviously with the Thanksgiving holiday just around the corner, a week or so away, I bet we can all imagine people are still going to be gathering despite what recommendations are. So I guess your perspective on that, do you think it's appropriate for a shutdown?
So I think a shutdown is just a very difficult place to put the entire community in, as well as the state and or nation. And so I believe the legislators and governors and state officials are really looking at targeted mitigation, because that would seem to make the most sense. So at this point, we are urging families to not gather for Thanksgiving. I cannot urge you more strongly to consider having your meal at home with those that you live with, and not to have a meal with others that do not live in your home. It is just so important at this time. And I think you'll see more targeted mitigations as those things are discussed at the governor's level.
And then really quick, following the governor's conference yesterday, it was either Governor Tom Wolf or Secretary Rachel Levine, after they announced their new mitigation efforts that they are kind of passing throughout the state. They said basically it was up to the counties to enforce. So I guess, would you take those proactive measures, I guess, to combat the virus?
So if you're referring to enforcing what the state has put forward, we will continue to do to our best ability and within the powers that we have available to us to follow those guidance, the new orders, the changes, such as wearing masks outdoors and such. Do I have more people to do that? Do more policing at the health? No, we don't. And so locally, we're asking people, the residents, those that live here, to do the right thing. I think we're so far beyond policing this. It needs to be social responsibility, really. Thank you.
Yes, and I'm going to just add to that we've gotten a few calls into our office, and I know they've come into the health department, particularly from businesses who want to follow the guidelines. They want to do the right thing, and they've been doing the right thing. And I've said this many times. In Erie County, we've done so much better than so many other places in terms of our businesses following the guidelines. And I just have to commend them for doing that. But now Director Lyon and Dr. Nadworny have talked about social responsibility. And it really is about each of us doing the right thing. And I implore you not to have a Friendsgiving, not to have Thanksgiving with other people that don't live in your home with you. And now we'll ask the Erie Times News. Is it David today?
Yes, Kathy, it's David. I was able to ask Melissa yesterday about her thoughts about Dr. Levine's orders and if they went far enough. I wanted to put the question to you. These were very targeted measures that she had on traveling and changes with mask wearing. Do you feel that these went far enough? Do you feel that the state needs to expand upon what was announced yesterday?
I think for me, I'm glad to see further guidelines on the masking. I think that's really important. I'm also glad to see maybe a little bit easier travel and more understandable travel restrictions. So that I think is good. What I would like to see is some reduction in the number of people who can gather. That concerns me. And kind of going back to what I was just saying, I get concerned if I hear of any business or group that wants to have, for example, a holiday party. That should not be happening this year. So I would love to see some restrictions around gathering. And this has been something that's been discussed across the state. If one county does this, then people, businesses, whoever is organizing may just go to the next county, may just go from Erie County to Crawford County or to Warren County and find a place where they can gather. And unfortunately, they don't have health departments in those counties, and so it would be much harder for them to put these. In fact, they really wouldn't be able to put these kind of restrictions in place, only counties with health departments. And I think Allegheny County is looking at the same issue. If they put those kind of restrictions on in Allegheny County, they can just go to any of the number of counties surrounding them. So I think it would be best if that was done on a state level.
And then have you had any word in the last 24 hours or so that there are going to be further mitigation orders from the state?
I have not. I have certainly expressed to the governor's office my desire that they do something more comprehensive on a statewide level, but we have not heard anything further. I think we have a couple other entities with us today. I think potentially the West County Journal's with us. Sandy, are you with us?
I am.
Okay.
I am. Thank you. I wanted to get some feedback from you guys. You know, we have the trinity of prevention, which is the social distancing, the masks, and the hand washing. Is there anything else that you can throw out there that people can do to, you know, prevent the spread? And can you speak to how frustrating it is for you as county officials that it seems like people aren't taking this seriously, and as the number of cases go up, it's, you know, it has to be frustrating for you. And I don't want to speak for you, but can you speak to that?
Dr. Nadworny or Director Lyon, do you want to speak first to this, either one of you?
I would like to address it first. What's very frustrating to me is that the science has shown that if everyone wore masks around each other, the risk of spread would be decreased by anywhere from 80% to 95%. Just doing that, wearing a multi-layer mask that fits well around other people all the time makes that much difference. And yet, I see people wearing masks under their noses. I see people not wearing their masks, although the majority of people in Erie who are out at shopping do wear masks. But it is the people getting together in offices and social gatherings and little parties that are causing this to spread, and then it's being spread to their family members. If we did something as simple as that, it would make a huge difference. And I think that's why we're not seeing it spread in retail businesses and in factories, because they are doing what needs to be done appropriately. And so it's very hard when it really depends on behavior. And even though that behavior is simple, it seems that many people have just decided that they don't want to do it. So I'm pleading with everyone to try doing that, because if we could do that consistently, not have group gatherings and everyone wearing masks when they were outside their house and trying to stay home, or at least avoiding crowds when they go out, we could make a big difference fairly rapidly and successfully.
Thank you. Thank you, Dr. Nadworny. I think we also might have the Corey Journal with us today. Maybe not. Okay, so we'll go back to Erie News Now.
A question for perhaps Dr. Nadworny as well as the County Executive or Director Lyon. Take your pick here. Let's start with you, County Executive. As we look at the measures that the state just put in place, judging by the apparent lack of personal responsibility you've discussed earlier during this news conference, is there any reason to believe that those mitigation efforts will work? Is there any hope associated with those when they're things that really have to be policed on an individual basis?
Well, for me, I think one of the things that will be better is the new expanded masking order, that you have to wear a mask no matter what you're doing inside, so you can't take it off. So I've already received a couple notices from a couple exercise locations saying everyone will be wearing a mask 100% of the time now. So there's an example of an improvement in that. So I do think that expanded masking guidelines will help. As Dr. Nadworny said, we know masking actually works, and so we need to do that everywhere. I'll leave it up now to Director Lyon to see if she has anything else she wants to say about those expanded guidelines.
I was actually asked to reiterate the fact that with that expanded mask order, it does indicate that all athletes and coaches must be wearing masks throughout the entire activity of the sporting event. And we double checked and asked directly back to the state, and that is correct, indoors and outdoors. So they really did put additional measures around the mask order, that it's no longer I have to wear it here and I don't have to wear it there. It's more along the lines of you have to wear it everywhere, and where you don't get to wear it, where you don't have to wear it, is in your home with the people you live with. But other than that, you should be wearing a mask at all times, especially. I mean, and if you're able. I mean, there are some small exceptions as far as some medical reasons, but I am not encouraging people to use those as a loophole. I am really urging everyone to wear that mask all of the time. Thank you.
Director, if I could follow up on that then. A, do you think that we will see a winter sports season in high schools? And then if we do, would that mean that student athletes during competition would be masked?
That is how it is written, and that is how it is to be interpreted, and we verified that. So that is correct.
Thanks.
Talk Erie. Joel.
Thank you, Kathy. I have a question for Director Lyons. We're getting questions in to the radio show here regarding how the active and recovered lists are maintained, especially given the news releases that are saying we're no longer calling every single person that has a positive test. How do we know when you're on an active list and then when you're on the recovered list, Melissa?
Yeah, thank you for the question. And I had anticipated that question would come to me at some point, either in today's press briefing or a future one. And at this point, it's using an algorithm that is the state algorithm, basically indicating from the date of the test of that positive person, 10 days prior to that coming out of isolation, and 11 days that they would be recovered. We know that that is not always accurate because people can have symptoms beyond the 10 days, and they may be hospitalized and they may be receiving treatment, and we may not always have that information now because we're unable to do the comprehensive disease investigation that we had been doing and staying in touch with the positives. So really, if you can imagine, when we had 20 cases and 40 cases, while that was still heavy work, we were able to maintain that. Now at 160 plus and hundreds day after day after day, there is no way to have an incredibly accurate number. The other piece that I think is worth sharing at this time is when we do disease investigation and we identify the contacts, and when they are being contacted to say you have been exposed to a known positive, if they are symptomatic and if they meet the clinical definition, they would fall into the category of what we call the probable cases. And in reality, what we're reporting now are primarily laboratory confirmed cases because we are not capturing as many of those probable cases that we would if we were doing comprehensive disease investigation. So what I'm telling you is while these numbers are being reported high, they're higher than what we're even reporting. So thank you for asking the question.
Thank you. Just a quick follow-up. is Erie County's position when it comes to contact tracing and disease investigation at a par, below, or above what the state is doing? I mean, is there a situation where we're still doing better than the state when it comes to this part of the disease mitigation?
So at this point, we're about on par with what we're seeing across the state. They are behind in disease investigation if they're doing it at all. So letters are being generated and sent to the known positives. If we can get contacts of the known positives, the state regional contact tracing coalition has been assisting us with contact tracing. So we are doing as much of it as we can in collaboration with the state, but unfortunately, this is happening all across the Commonwealth.
Thanks so much.
Thank you. Samir, Jet TV.
Yes, thank you. So it goes without saying, I believe, that we kind of have asked community residents to be socially responsible throughout the pandemic. I guess you can say it's worked or it's been a failure. So what leads you to believe that now asking the community to be socially responsible is something that will work and be a mitigation effort that brings in positive outcomes?
There's no guarantee. I'm an optimist always, and I have a lot of faith in humanity, I guess, and I always have had a lot of faith in this community. I think one of the differences that's happened now is more and more people know someone. They know someone who's been diagnosed. They may even know someone who's hospitalized, or worse yet, they may even have knowledge and close connection with someone who has died. So I think as more people see that this is actually affecting them, the people they know, their family members, etc., it becomes a real, and I'm an optimist that people will see the severity and the dangerousness of where we're going and do the right thing.
And then just to follow up, I want to circle back around to mitigation efforts in regards to closure or any possible action taken by your administration. So taking a look at that, right now we just have a blank canvas. Can you paint somewhat of a picture? That way I have an idea of what these measures would look like. Would that be a new curfew possibly? Or just give me a little bit more insight if you can.
Well, honestly, Samir, we do not know what those would be at this point, and we are looking at a number of things, as I mentioned already. And one of the things I would love to see is somehow a reduction in the number of people that can gather. I was glad to hear that there was a craft fair that was supposed to be this weekend and it got canceled. Those kind of things, in my opinion, should not be happening. So I think every organization who's been planning something really needs to think about, is this a safe activity or not? And if it has any indication that it's not safe, they need to cancel it. So that's, but again, we don't have any specifics to bring out on that subject at this point.
And then if the county were to see, I guess, let's say after Thanksgiving, we're pretty close to 200 cases. Yesterday, 167, not far stretch from 200. If we do talk that, I guess, are you going to move a lot faster in regards to new efforts? What would take place?
No, the numbers are already high enough. We're looking at this right now. We're not waiting for us to reach 200 or some other magic number. It's the numbers are high now. The hospitalizations, we're monitoring those very, very carefully. Obviously, that if the hospitals become overwhelmed, that's potentially a time when we might make some kind of more drastic move. But we're still looking at doing something now because we can't wait for that to happen. We need to stop that from happening now. And again, we implore the people of this community to take social responsibility. We're talking about everyone wearing a mask. You know, I get frustrated sometimes because I think about what my grandparents and my parents talked about and the sacrifices that people made during World War II and during the Depression for the good of this country, for the good of every other person. And I find it frustrating that sometimes there are people in our community now who do not see that this tiny sacrifice of wearing a mask is worth it to protect the lives and the health of people in this community. So yes, I am frustrated by this, but again, I believe in the people of Erie County. I believe in the goodness of the people of Erie County, that you will look out for your fellow resident, that you will look out for your fellow human being and do the right thing going forward. Erie Times News, David.
Yes, Kathy, you mentioned a couple of times about how you'd like to see lower numbers for the maximum number of people who can gather. Did that play the major role in the decision to close the library on Saturday to in-person visits?
Well, I was going to bring that up after these questions, but yes, the library is closing down as of Saturday. We're going to be doing only curbside drop-off and delivery. So if you want a book or something else from the library, you can get it, but you'll just have to call in or order it online, and we will bring it to your car. And that we do not believe that people should be gathering. And of course, the library is the one place in county government where people do gather for a very non-essential, although we all love our library, and I think it's essential in our ultimate life, it's not essential at this moment. So we are moving to curbside pickup only.
Were there any cases that that were spread through visits to the library? Because it seems like it was pretty strict protocols there.
We have very strict protocol, and we do not believe that we have any cases from the library. But again, we're trying to do our part. We're trying to be the example to the community of what should be done. And again, the library is not essential at this particular moment. And so we felt we needed to close down the library to do any little bit we can to help protect this community and its citizens.
Thank you.
All right. And Sandy, do you have any last question? We're going to finish up here then with you.
I do have one quick question. I'm sure you'd heard yesterday Dr. Fauci had mentioned that perhaps we need one unified nationwide effort and not be state by state. Is that something you would embrace? Do you think that would be better for the nation as well as for Erie County to have something nationwide?
I definitely believe a unified national strategy should have been in place months ago and needs to be in place going forward. Again, I talked about the Commonwealth having one strategy, but we also border New York and Ohio. So if we have a strategy in Pennsylvania, well, maybe now they can't go to Crawford or Warren to do these large gatherings, but they could go potentially to Ohio. I think New York actually has some restrictions on that now. But a unified strategy, because we are one country and we don't have border crossings. We just go from state to state, county to county, seamlessly. And so we do need to have that national strategy.
Thank you.
Thank you. Thank you all for your questions. I will just finish up by, I always like to highlight a couple of our businesses because we do have businesses doing really good work. I want to highlight Fairfield Beer Distributor on Route 5 in Harbor Creek. We stopped there this weekend, shield in front of the checkout counter, the individual working there, wearing gloves, a mask, everybody kept socially distanced, doing very good mitigation efforts. Very nice small business, and I'd love to see that. Panache Salon and Spa, since yesterday's new orders came out, they have taken upon themselves to cease doing facials and waxing for now to protect their clients and their employees. So I applaud the businesses who are really working hard to try to do the right thing. Obviously, they want to stay in business, stay open, but they're really trying to work hard to keep our community safe. And so with that being said, I look forward to seeing you all next Wednesday, the day before Thanksgiving, but please work hard on your Thanksgiving plans now to keep them as safe as possible, as small as possible, and as close to home as possible. And please stay safe over this next week. And as always, please try to stay calm throughout this pandemic. Thank you to Dr. Nadworny and Director Lyon for being with me today.